Today we're focusing on a part of our lives that often goes unnoticed until we or our loved ones need it: primary health care. The local clinics that should provide essential care right in our communities. Now, recently, the federal government released 3.9 billion naira through the Basic Health Care Provision Fund, aimed at improving these facilities, buying medicines, repairing buildings, and supporting emergency care. But while the money is now in the accounts of local centers, the real question is, does it reach the people who need it the most? Now, across Nigeria, families still share stories of waiting hours for treatment, traveling long distances for basic care, or finding clinics without enough staff or essential drugs. Mohammed Pate, the health minister, says it's up to communities to ensure these funds make a difference. Each naira, he says, is a seed that can grow into safe births, medicine, and lives saved, but only if citizens are involved and vigilant. So today we want to hear your story. Have you or your family benefited from your local primary health care? Are there challenges that need urgent attention? Call us in on the numbers displayed on your screen or send us a WhatsApp message. We'd like to hear from you, because behind every statistic, there is a life, a mother, a child, and a neighbor waiting for care. So now let's talk about it. Make sure you call us in. Would like to hear from you. Let us hear what the state or the condition of the primary health care in your vicinity is. Maimuna, there are lots of things that are going on when it comes to the healthcare sector, and trickling down to primary healthcares are quite important and vital, especially in communities, in villages. You know, having to go to a healthcare facility, a primary healthcare facility, without even meeting, someone that can be able to attend to you. Excuse me, someone that can be able to attend to you. And aside from having some professional that can be able to attend to you, the lack of, having a proper facility, equipment, as well as medication that can be administered to sick people.
And first, to start with, I would say it's a good news to know that the federal government has released 32.9 billion naira, through the Basic Healthcare Provision Fund, and it is aimed to improving, the primary healthcare centers. Good news. We're excited to hear about it. But what I would always say is, how can we be able to trace and make sure that these funds are being utilized rightly for the right cause?
As we always say,
as we always come to the point,
exactly. Implementation. That is the biggest issue that we have here in Nigeria.
I know that I have been able to visit some few primary healthcare centers. I remembered when I wanted to take my COVID vaccine and I went to a primary healthcare center, they were not having any at that point. And, there are lots of complaints from Nigeria are saying that mothers who are pregnant and want to give birth have to travel long distance for them to get access to medical attention, as well as, minor things that the primary healthcare centers need to attend to first. And then when it's out of their control, they can refer them to, other hospitals that have the bigger facilities to attend to them.
And staff as well.
But then it is very important that we know that the primary healthcare is for the grassroots level, where you go to first to get medical attention. But when these facilities are not being equipped to attend to the people in that community, it becomes a big headache to start with. I mean, we have emergencies at night. People, do get emergencies at night, and then they go to these primary healthcare centers, and at the end of the day, they don't get attention. But then we have Ade on the line. Hello, Ade. Good morning. Thank you for calling in this morning.
Good morning. Good morning, Maimuna. Good morning, Hauwa. How are you?
Good morning, Ade. Thank you for joining us.
Let me tell you one thing. There is nothing like health center in Nigeria, because what they have is just a building, a small building, nothing inside. My people still complained to me yesterday that when they went to hospital, there is nothing there. I have to send them to private clinic where I paid a lot of money. I don't like health care at all. The man who is the minister of health now is well knowledgeable man, well experienced, well exposed. I wonder why I cannot introduce health center and follow it up. He only introduced on TV. When I'm watching that, there's health center everywhere. If you go there, nothing inside. So, and this is very important because that's closer to the people. If you don't have it, people who are sick, poor people, they will suffer. I told you in my own street, we have two. You know, 4 bus stop to my house. On my left, we have a fantastic clinic. To my right, we have fantastic clinic. Even in my own clinic, we have 15,000 patients. Not that they come one day, but maybe 10, 20 days. If you need them, you just check on your phone, order for your prescription, or book your appointment, whatever you want, through your phone. Then I'm not saying they should use that in Nigeria now because that will be too, maybe that will be too expensive for them. They let there be medication in health center. Let there be doctor, let there be nurses in health center that can attend to people, most especially the common sickness, malaria. So when they come there, they will give them the tablet and give them this and to treat themselves, the poor people. Those who have money to pay for the medication, but those who are poor should be given free medication. I mean, that's how to help the people because health is wealth. When you are not okay, there's nothing you can't be happy. Imagine now the millionaire in Nigeria, the billionaires, when they have headache, they run to London. They go to hospital here. You know how much they charge them? Thousands of pounds. And they will pay. You can imagine. In London here, you will see a Nigerian doctor, a Nigerian nurse, in the same London. And they run away from Nigerian nurse in Nigeria. So why not develop our own and let our people be happy? That's my whole advice to Ali Patrick, the Minister of Health. Go around, go and check all the health center everywhere. Where you have invested this money, are they functioning? Do they have doctors there? Do they have nurses there? Our people are just dying unnecessarily. People are supposed to live long. They just die prematurely. They say, and God doesn't kill anybody. So all this laxity of the government, you see, they don't do the right thing about health and education. These are my priorities. They should do something about this quickly. But I pray God will uphold my country, God will bless Nigeria, and God will give us good government. Good morning, ladies. Have a nice day.
All right, thank you very much, Ade, for your thoughts and opinions. And, you know, according to the minister, the health minister, he says these funds are already, in the accounts of those that are responsible in making sure that these primary health cares are brought up to par and make sure that they are fully functional. But one thing that has to be remembered is these healthcare facilities, as you mentioned earlier, are those facilities that can be easily accessed at the grassroots, at the communities, and they need to be properly functional for us to have proper medical practitioners that are there, nurses, midwives as well. And the biggest part that a lot of women lose their lives because there aren't proper facilities, equipment in those primary health cares, and before they can even reach hospitals, they've lost their lives, they've lost blood and all of that.
We have Shatima on the line.
Absolutely.
Good morning, Shatima. Thank you for calling in this morning.
Good morning, Maimuna. Good morning, Hauwa. Good morning, Trust TV. Good morning, Nigeria. This is Shatima Yakudima calling from Maiduguri.
Thank you for calling in, Shatima.
Shatima.
Talk to us this morning. The primary healthcare center in your area, do they have enough drugs?
What is their condition?
Absolutely. Would like to hear that from you this morning.
Are you talking about the primary healthcare?
Yes.
Okay. Because I'm not at home. I'm not watching you people.
Oh,
All
okay.
right.
I just called to know the topic.
Okay.
All right.
Okay.
So we're discussing the primary health care and the conditions in your area. Some funds have been released by the federal government to make sure that these facilities are up to par. So we'd like to hear from you what the condition is in your area.
Well, honestly speaking, we can say the maintenance is full, and also the structures is not up to what we are expecting. Even though we sincerely thanks to our governor, Professor Babagana Marazulu, who is repairing even before the intervention of the federal government. Alhamdulillah, here in Maiduguri we can see the changes in the primary health care. Because some of the places our governor had built it with his own, with his own allocation, and have stocked all the necessary equipment. So Alhamdulillah, we thank God for that. But the problem that we are having, is the rural area. In the rural area, honestly speaking, due to lack of security, there is nothing to show about. And this is something that beyond the government control. And you see the Maiduguri surrounding, Alhamdulillah, he have made his best, honestly speaking. But in the other areas, that's where, in the rural areas, that's where we have problems, especially local government headquarters. There is a problem. Sometimes, even if they build it, they stock everything. This Boko Haram, they have become a disaster. They go and burn it to ashes, and they have been causing a lot of losses to the government. So honestly speaking, here in Maiduguri, Alhamdulillah, we thank God for that. And we are hoping and praying peace to restore, and we are praying for the successor of the Professor Babagana Umar Zulum to stand up to task, to carry on the good work that Professor left. So Alhamdulillah, we thank God for that. And we are hoping and praying all the governors in the 36 states to do their best to utilize that pounds that released by the federal government, because this is a trust that given to you. You don't have to betray the people, because this is a trust whereby Almighty Allah will ask you and you will account for it. So we are hoping and praying. Health matter is the number one priority. After health, then education. After education, then other things follows. Agriculture and rest. So we are hoping and praying all the excellencies that the money they have trusted to them to please use it wisely. So we are hoping and praying for the State House of Assembly to intervene to see that every governor have give account of that money. Thank you so much and have a nice day.
Thank you, Shatima, for calling in this morning.
For that.
Another thing we need to, talk about is creating awareness to Nigerians. Let them know that, this fund that have been released is not for anything, but for them to know that it is meant to be used for the primary healthcare centers. And they are also needed to put their hands together to make sure that these funds are being utilized and, used to the letter. We have another caller on the line. Hello, good morning. Thank you for calling in. What's your name and where are you calling from?
Good morning, ladies. This is Abasenkon calling from Kokosi.
Good morning.
Good morning, Abasenkon. Thank you for joining us. Go ahead with your thoughts.
Trust TV is a session to do. I appreciate Trust TV in all that clarity. Sincerely speaking, when we talk about primary health care, what is primary health care? It's a medium whereby somebody who has an injury, malaria, headache, can just go there and take treatment for free. If that is not on ground, or if it is in a distant place, there is a problem. Why do I say there is a problem? There were about 4 women within my vicinity here. They delivered in their homes. They were not having money. And where they have health care is at Pantami. So how will they be able to reach there? So all I did was to advise them, that they must go and take the basic treatment. That is the first injection, to which they did. And the other 2, I don't know whether they did, but the 2 that I know of, I gave them treatment. I said they should ensure they go. And eventually, when I went back, they said they do. But you see, there is poverty in the land. There is real poverty. So the federal government should do something and make sure if it is primary health care, they have to give street by street. Very fine. Because without doing that, a lot of people are dying of malnutrition. A lot of people are dying of common headache. Common headache is sickness. So, typhoid is sickness. A lot of people can pass on because of that. So the government should do something. This money they allege to have released, or they have alleged to have that is on ground, they should give it to credible people that will utilize this money. I have a lot of friends, I have brothers abroad, most especially London. They have, Nigerians are the best consultants there. In America, we have one of the best. In Saudi Arabia, Nigerians are one of the best doctors. But why is it that they are they are running away from here? It's because they don't take good care of them. We should start taking good care of what we have. If the government can do that, the government of President Tinubu, please ensure that doctors are being taken care of, teachers are being taken care of, the police are being taken care of. I listened this morning what the Chief of Defense Staff was saying. He said it is not their primary duty to do the functions of the police. Severally have been saying it here. So we are just doing things lackadaisically, things that are not supposed to be doing, we are doing them. So thank you, Trust TV, for this wonderful topic you have brought on board. I appreciate you people. I also appreciate Nigerians for constantly listening to Trust TV. God bless Trust TV. God bless Nigeria. I appreciate you.
Thank you, Basinko. Maimuna, looking at this, something caught my attention. According to the minister, that this is the third round, of disbursement in 2025, and it begs to ask the question: what happened with the first and the second round of disbursement? Have they reached where they need to reach? Have those funds been used accordingly for what they're meant for? So this brings us back to accountability, implementation, and they don't track progress as well. There's supposed to be something in place that makes sure that these the work that's supposed to be done is being done by the people responsible. And aside from that, saying that the citizens have to hold those responsible accountable for these funds and the implementation of making sure that primary health cares are brought up to par is quite tasking for the citizens really as well, because I believe it has to be at a point where the Nigerian understands that they do have the right to question what is going on, because it is for them, it is for Nigerians, and everyone has to be held accountable. But let's take our next caller. Hello, good morning. Thank you for joining us. What is your name and where are you calling from?
Hello, good morning. My name is Abdul Malik Jawi Pala, calling from Yobe State.
Good morning, Abdul Malik. Go ahead with your thoughts.
Yeah, on the aspect of primary health care, Governor Maimuna, the governor of Yobe State, has really done wonders on that. Before this administration of President Bola Tinubu, we can recall that Governor Maimuna has upgraded 138 primary health care systems in Yobe State. And Governor Maimuna is the one that introduced healthcare contributory money for workers to subsidize medicine. And if you check primary healthcare in Yobe State, you'll find them adequately equipped, and solar system lighting. You find staff, that's the nurses and midwives, to employ them on a regular basis. So before this administration, I'm not trying to be, I'm not with them actually, because I was the party secretary of NMPP before. But on the aspect of that, I know he has done a lot, and he has contributed to the healthcare system. So with this opportunity given by the President of the Federal Republic of Nigeria, I know he will do a lot on that aspect, because it's where you score him 100%. So that's my contribution to that. I know he has done a lot.
All right, thank you very much. Maimuna, when we look at these issues, there are exceptions when it comes to implementation. There are others that go, across, above and beyond to do what is necessary, making sure that their people are doing okay. But what we have to remember is, when it comes to making sure these facilities are up and running, it is not just a facility, it is not just the equipment that are there. Manpower is needed as well, and proper welfare, so that those people that are employed to do the job are comfortable in their domain and do their job properly as well.
And then apart from that, every single person in the primary healthcare system that is working there needs to have the fear of God to start with. But then we have another caller and then we'll come back and talk about that. Hello, good morning. Thank you for calling in. What's your name and where are you calling from?
My name is Joel David Yaji, and I'm calling from Taraba State.
Thank you for calling in this morning.
Good morning, Joel.
Talk to us about the situation of the primary healthcare in your area. We'd love to hear what is going on there.
Okay, the primary healthcare in my area is a very terrible one. I come from the most complex terrain in Nigeria, from the Nambila Plateau.
Oh.
Particularly my village. If I leave Jalingo to get to my village, it costs me about 30,000 naira because of the distance. So the people in the village, before accessing healthcare, is very, very challenging before they get to the local government headquarters. The primary healthcare, they are just mostly empty structures, or you meet one community health worker or a JQ that is managing the place. So it has not been helpful. Having said that, I think we should applaud President Bola Tinubu for this wonderful initiative and the Minister of Health. But I think my major take on this is that there should be a website or a place where every kobo that has been sent to every primary healthcare across the country should be published. So that me in particular, if I checked what has been sent to my community, I can be able to hold the people managing the place responsible. I will tell them XYZ amount of money has been sent. We want to know how that money has been used. But when you don't have the figures, holding them accountable becomes a challenge. So this is my major take on this. And there should be a very good scrutiny of how the funds are used by the government and by the people of the community. But the people of the community can only do that if they have a very clear figure of what has been sent and how it has been sent. The money should stop going through a central account in the state government or whatever. It should go straight to each community to avoid stories. Like what the Hausa people will say, thank you very much, Trust TV, for this wonderful program, and do have a lovely day.
All right, thank you very much, Joe, for your contribution and thoughts when it comes to this topic. You know, accountability is quite important, keeping those responsible on their toes and making sure that they know that they have to do the right thing, because at the end of the day, you always say this, the Nigerian
are always at the receiving end.
Always at the receiving
But then
end.
I would like to let the last caller that just called, you can visit their website of the Federal Ministry of Health and Social Welfare to get enough information. Now, before we finish this segment, I'll pull out the website that people can be able to visit and check if these informations that we are giving you right now this morning is on the website, and how you can be able to track this funds as well.
All right, let's take our next caller. Hello, good morning. Thank you for joining us.
Good morning, TV.
Yes, this is
good morning.
My name is Abakar, calling you from Gwagwalada.
All right, good morning, Abakar. Go ahead with your thoughts.
In our own case here, we have a growing population. Most of the primary health care centers are being overwhelmed. So we need the expansion of the primary health care facilities here in Gwagwalada, and I need to change the mode of operation of most of these primary health care center facilities. Most of the staff report to duty late. They report to duty late, and they close very early. So, and most of the facilities lack essential drugs. Most of the patients when they patronize this center, they have to go outside to procure drugs from chemists and what have you. So we need a function of this facility. That is the state of situation here in Guagualada. Thank you.
All right, thank you for calling in this morning.
We'll be taking a couple of WhatsApp messages. And the first one we have from Comrade Nansat from Jos. It says, good morning, Trust TV. The Nigerian healthcare system is facing very serious challenges. Check out the building infrastructure, check out the drugs, and indeed the staff. The so-called funds does end up in private pockets. In my place, in Panshin South, the centers are not enough. The buildings are in very bad shape. Drugs are empty. Sanitation is so bad. The people should be involved in the process of purchasing of drugs and the rehabilitation of the centers. Thank you very much, Nansat from Jos.
All right, we have another caller on the line. Hello, good morning. Thank you for calling in. What's your name and where are you calling from? Okay, good morning. Thank you for calling in. But please kindly turn down the audio of your TV set so we can hear you clearly. Thank you.
Can you hear me now?
Yes, we can. Please kindly go ahead.
On this program, I have to say I will give it 100% to our governor. Yes. That's why we have other people criticize his policy and governance, but on this aspect, I think we don't have any primary health in our community, in our state. They are all being upgraded to hospitals. The structure and the equipment and the quality is being rendered. So on this program, I have to say it's a goal for him. And whenever you have another program that has to do with what you say or contribute positively or negatively, we'll still call you to pay a team or two about it. May God bless and trust you.
Thank you for calling in this morning. How I think we still have more messages to read out this morning.
A message from Adamu Muhammad Usman from Kafang Hausa in Jigawa State. And he says, good morning, Trust family, and good morning, Nigerians. Primary healthcare is getting attention in Jigawa State, but notwithstanding, more should be done in that area because it is supposed to be a continuous process because of birth rate, inflation, and poverty in the land. At this juncture, I will appeal to Jigawa State Governor Malam Omar Namadi Damodi to visit the Hauwa Lafia scheme, that body that was introduced by the former governor Sulalamido, because that package has yielded a positive result to the rural areas across the state. The downtrodden have truly enjoyed it well. All right, thank you very much, Adamu from Jigawa State.
Okay, Hauwa, before we end this segment, I just want the viewers to know that they can visit health.gov.ng. It is the official website of the Nigerian Federal Ministry of Health and Social Welfare, so you can get enough information concerning what we're discussing this morning. And then also you can visit fmoconnect.gov.ng. Now, this particular website hosts department platforms and health data registries connected to the ministries of work. And then for those that are always asking about health insurances and what have you, that's for the basic healthcare provision fund, specifically the National Health Insurance Authority. You can visit www.nhia.gov.ng/basic healthcare provision fund. Now, these websites are there for you to visit so you can get enough information concerning the primary healthcare system, how it works, and the money that was disbursed, if it has gotten to your community. It is very, very important that Nigerians are aware.
But Maimuna, the reality of the matter is the people that would benefit from these primary healthcare systems wouldn't necessarily be able to visit those websites and be able to look up statistics, look up the funds that have been allocated, or even hold anyone accountable for that. Only from the grassroots, and I hope that they do that.
Absolutely.
All right, that is all we have for the segment.